Hi, this is Maria. I'm with Henriette, a Hub International company, and I am going to go over your Part D benefits and how to do a review. So we're going to get ahead of the curve here. I know we're still in the middle of the year, but new plans come out in October. You will receive around October 1, they mail them out on September 25th. You will receive what's called an annual notice of change. This annual notice of change will tell you what is your current plan premium, what is your new plan premium. It will give you copay or co-insurance information depending on what tier your medication is. So the first thing you need to do is take a look at this document when you receive it at the beginning of October. Okay. So it will have some very important information on it. You may not need to make a change, and if you don't, there is nothing that you will need to do for the new year. Your plan will roll over automatically into whatever premium the plan has for the new year and the benefit structure. But if you want to make sure that it's still the best plan for you and whether or not you should make a change, you're going to want to take a look at the Medicare.gov plan finder and enter your medications to evaluate your best option for the coming year. So we're going to go ahead and enter your medications. I will show you how to do that. Of course, we're middle of the year, so we're just not going to really be able to compare anything to 2026 yet, but this will give you a very good idea of how to do this. We have decided, of course, as you know, that we will not be sending the letters out for AEP or doing the Part D reviews, simply because last year, as open enrollment started, most of the carriers at that time had said, no, we're not going to pay you the fee that the government sets. So instead of it being paid by most carriers, they have decided not to pay us. There were a few that just in the last couple of months stopped paying us as well. So we're anticipating by 2026, we won't be able to collect any fees for Part D reviews or writing Part D plans for people. So just not a good business model. We need to, unfortunately, collect fees in order to continue to do our work here at Henriette. But we want to make sure that you're equipped to do your own review and take a look at everything. So keep in mind, this is not for people with Medicare Advantage plans. If you have an Advantage plan, you get your annual notice of change. If you're not happy with your plan and you want to look at a new plan, we are still doing that work. We are not doing the Part D only reviews where people might have a Medicare supplement plan with just Part D. Okay, so our focus today is drug coverage only. All right, take a look at your annual notice of change, pull up the Medicare.gov site. Okay, so when you get here, you're going to go to Find Health and Drug Plans, and then it will prompt you on the next page to enter your zip code. I'm going to go ahead and use our local zip code where I'm located, 47906 here for our office. And you'll see then you choose what county you live in. Now, I realize many of you may get your health care or use a pharmacy in another county. This is all in regards to what county do you live in? Where is your residence? Because you have to be enrolled in a plan in your residence. So put in the zip code where you live. Choose the county where you live. Click continue. And then specifically, we are looking at Medicare Part D drug plans today. You can look at Advantage plans here, but we're going to focus on drug plans. You can also see Medigap or Medicare supplement here, basic information, but then they would turn you over to an agent just that does exactly the same thing that I do. Okay, so Part D drug plans, we're going to then click Find Plans. And then it will ask you some questions about whether or not you have Medicaid or extra help due to low income. So we're going to do, you don't get any of these extra help programs. Continue. Do you want to look at drugs? So definitely want to take a look at the drugs, and we're going to click next. Now at this point, we are going to enter some medications for you. So I've got some examples here to use. I'm going to start with lisinopril. This is a common blood pressure medicine. If you're just taking lisinopril, it will be this option. If you take the combined hydrochlorothiazide lisinopril, make sure that you choose that. So lisinopril, we're going to add the drug. You need to do the drop down and choose whatever dosage you are taking. Okay, we're going to say 20 milligram. Now look at your bottle. Do you get a 30-day or a 90-day supply? So we're going to say 90 days. So 90 tablets over 3 months. Okay, we're going to add this to the drug list. I'm going to add another medicine here. Let's use metoprolol. So I want to use this as an example because many people who are taking it don't realize it comes as metoprolol tartrate or metoprolol succinate. Make sure you choose which one you take. I'm going to put in succinate, add the drug, and then here you will see it has the dosages. I'll go ahead and say 50 milligram. Let's say this one is 1 time a day every month. Okay, we'll add that to the list. Now, if you do take any medicines that you take as an as needed basis, you could enter that medicine. So I'm going to use nitroglycerin here. So let's say you carry around that little tiny bottle of pills. 0.4 milligrams sublingual is typically what I see here. Look at your little bottle. Normally it's 25 tablets, and you might pick up a new bottle every year. Okay? And then we would add to drug list. So if there is anything you're taking PRN or as needed, I recommend you put in however many pills that you get at a time and put it in once every 12 months just to get a price point. Okay. If it's 8 or 9 pills, just put in 8 or 9 every 12 months. Okay. So for now, we're just going to look at the plans using these 3. We'll come back, we'll add a couple others to show you maybe more brand name medications and talk about insulin. So we're done adding drugs. On the next screen, we are going to choose a pharmacy. So we have, say, mail order. Say you want to choose a mail order pharmacy, price that out. Each carrier uses their own mail order provider. So if you're currently using mail order, do know that you'll have to use whatever mail order provider each insurance company provides for you. Maybe you want to check out Walmart, Payless, Walgreens, okay? If you're wanting to check out a specific, like one of the hospital pharmacies, type in that name. They're in a different zip code, put them here, okay? If you have, I'm going to show you an example of one in our area. This is a pharmacy in our area. Oh, let me get this zip code here. And, oh, it's not matching it. Well, let me try again here. Just doing this. What I want to be able to show you here, there, it was showing on the main page. Oh, I had a space between custom and plus, so that can be very important. You may have to retype it. In fact, if you in our area use Payless, some have Payless with 2 separate words, some are 1 word, okay? So just go back, you'll be able to find it if you put in the zip code eventually. What I want to point out here is this pharmacy, for example, you have your retail pharmacy location. You also have a long-term care pharmacy. That long-term care is where they deliver to nursing homes, so to the skilled nursing facilities. You would not want to choose that. That is not the retail pharmacy for Custom Plus, okay? So for now, we're just going to go mail order and a few retail pharmacies, click continue to view plans, and the system will automatically populate your lowest drug plus premium cost in order based on the retail pharmacy option here. Okay, so Keep in mind, you can then click compare, and as you scroll down, you're going to see lowest drug plus premium for the rest of the year. Now it is July as I'm doing this, so it is giving us pricing for premium plus your medications for August through December of 2025. Okay, so as you would go through, and we're going to compare these, okay, and you'll just see that the price points just keep getting higher. So this tool does the work for you. It matches what is your best premium plus medication for the rest of the year, or if you are entering this in October, looking at 2026, it will show the entire calendar year for you. Okay. Now we're going to go down and click compare. And now it will show those top 3 plans in a side-by-side option. Okay. Now, going back to this main page, let's say, I'm going to take off the last one, and let's say you were already enrolled in the Aetna Silver Script plan. That is $44.90. Or it went to that for this year. You would click that to have on your compare if you want to see what would it cost if I just stay on my current drug plan. Okay. So if you do nothing, you will automatically roll over to the new drug plan based on whatever premium they're charging for the new year. Okay. So you can see here, if this was your plan, well, it probably makes sense to switch over here. Okay. So pay attention to that annual notice of change, get on this tool, add your medicines, and then you will be able to see where your lowest cost structure is for premium plus medicine. Click plan details, and now it's going to tell you this is your monthly premium. This is what you will pay for medicine for the rest of the year. Now, I do want to point out there is a drug deductible. The drug deductible on most of the drug plans is the maximum amount allowed by the government. But this is where I wish the Medicare.gov system would put in here what tiers apply to the deductible. So I know, because of the fact that I have to do tests to stay certified to write Medicare every year, that the deductible only applies to tiers 3, 4, and 5 with this plan. Sometimes it applies to tiers 2 through 5. Maybe it's 2 through 6, or maybe it is all tiers. Ultimately, the figures they're giving you at the top applies the deductible if it applies to your tiers of medication. Okay. So as we scroll down through here, okay, you'll see it will recap your list. It will tell you which pharmacies are preferred and which are in network. So you can go to any pharmacy, but you will notice as we move forward, the in-network pharmacy with this plan of Walmart, in this example, you're going to pay more for your medicine because it's not at the preferred price points. If you are only using Walmart pharmacy, a different plan would come up as your better option to give you better pricing. Okay. This is yearly drug cost, meaning for the rest of the year, August through the end of December. As we look forward, this will tell us again, premium plus medication. This is a 0 premium plan. It's fully subsidized this year. I can't promise it will still be that way in 2026. This will map out each month what you would be paying for medications. Mail order is always 90-day. So remember, with that nitroglycerin, it is once a year. So it's showing costs at the beginning of the year and then nothing after that. You will then be able to look specifically at each pharmacy, your cost structure. I'm going to come back to that in just a moment because I want to show you, if you click on view more drug coverage, it will tell you your price points based on the tiers. So tier 1, 2, 3, 4, and 5. Okay, they tell you these are the tiers. You just have to assume they're in number order. And this is another place that I think they could state subject to deductible first. So for example, if you're taking a tier 3 medicine on this plan, you will have to pay full price until you hit $590, and then you would pay 25% coinsurance. Okay. This is telling you what tier each medicine is. Okay. The tiers help define the pricing. So if we go up here and let's just choose Walgreens, it's a preferred pharmacy. You will see here is the retail cost. The cost before and after deductible are the same on the tier 2 medicine because the max cost under a tier 2 for this plan is $5. Okay. So they're going to give you their negotiated price the entire time. It's going to look like they're not paying anything, but they've negotiated the price down. Okay. This is your retail cost of these two. They're tier 1, so it's no cost for those medicines. Now, if you want to add medicines to the list, you're going to go back up to the top and you will click Go Back to Plan Comparison. And it will show you the 3 plans you put in order. And then you'll go back to Plan Results where it has all 14 plans available in your area. And then back to Drugs and Pharmacies. Now, I want to add a couple other medicines so that you can keep some things in mind. I'm going to first enter a medicine called Celebrex. So Celebrex is a brand name medicine that has a generic. It is very important for you to know, are you taking the brand name or the generic of a medicine? The price point will be very different. And some brand name medicines, they will not cover on any Part D plans because there are generic equivalents that have been out for a very long time. So they do not cover the brand name. So we're going to click Add Generic. We're going to say you take this twice a day, but you get it in a 90-day supply. So that would be 180 pills every 3 months. Again, take a look at your bottle. Okay. I also want to add an insulin. So for those of you who have insulin, you have a really good idea of what you need to know. Over the years, people would send us units of insulin that they take in a day. We cannot enter units in a day. With this, you'll say, are you getting vials? Are you getting pen injectors? How do you purchase it? And then you need to put in here the closest answer to how many pens do you buy in a month? How many pens do you buy every 3 months? Okay, so let's say you get 3 packs of 5, or I'm sorry, a pack of 5 3 ml pens. I said that wrong. You get 1 of those every month. So we would add that to your list. Now I'm going to add another medicine that I know is a brand name and has some special requirements. So Mounjaro, it's a GLP-1. We're going to add this drug. You have to choose what size auto injector you are using. We're going to say the 7.5 mg, you get a pack of 4 every month. Okay. We'll add that to the list. So now you can recap, make sure you have everything entered as you pick them up. Okay. Done adding drugs. It's going to keep the same pharmacies that we had on here. Okay. So we'll just leave those pharmacies on here. By the way, if you did want to look at, say, Amazon pharmacy, Google the Amazon pharmacy address, put in that zip code, you would be able to add that. So that's another one that I will sometimes see people order medicines through. Continue to view plans. And now it's going to put them in order based on this new list of medicines and the pharmacy you prefer to use. How do we make sure you're getting the best overall cost? Now, they're always in order based on the retail pharmacy. Okay, so I'm going to take off another one of the plans here. I'm going to add back in now what is showing as your best option. We can look here as we go down. Sometimes they're not in order of mail order, so sometimes I will check to see if I'm interested in that, if there's a better price point. If you only put in mail order as your pharmacy of choice, then it will only put them in order based on the mail order number, okay? And again, mail order is whatever mail order provider that each carrier uses. All right, click compare again. And now you will be able to see based on these medication changes, this Humana plan with a higher premium is a better option. This number is premium plus medication for the rest of the year. So the zero premium plan, it's a good plan, but it clearly doesn't cover one of your medicines, okay? And part of the reason I know that is starting in 2025, there was a cap set of $2,000 that you can spend on your medicine or will spend on your medicine at the most. Now, it does have to be medicine that is on your formulary. You have to be getting it either through the retail pharmacy or mail order. Anything you're getting using GoodRx would not count, or if you order through a Canadian pharmacy, that will not count. This is only medicine on your formulary. It's not over-the-counter medicines. It's not, if you take prescription vitamins, Part D plans do not cover them. They would not count towards that cap for you, okay? If you're buying over-the-counter, say a Prilosec or Nexium, but you would rather get the prescription so it counts towards your cap, you could do that. But not all over-the-counter medicines that have a prescription equivalent are covered by Part D, okay? So keep that in mind. So with this, we would now look then at your best priced option, being this Humana Premier plan. And you'll see the monthly premium. And then this is costs of your medicine, lowest cost at one of the retail pharmacies I entered, and lowest with mail order, okay? As we go through, you can see this one has a premium that's much higher, but has a lower drug deductible, 0, in fact. It will recap your list. And it will once again tell us what's the yearly cost of each of your medicines at each pharmacy. You don't have to use mail order for all of your medicine if you don't want to, or you could use 2 different pharmacies. I see here like Celecoxib. Walmart always has a great price on it. The Humana plans tend to cover that medicine better than other drug plans. It's been that way for 4 or 5 years. But this tool maps that out for you. Of course, mail order at 0 looks pretty good too for that one. Okay, now we'll have drug plus premium combined. So where are you going to pay the lowest overall? Meaning Walmart has the lowest overall here, or no, I'm sorry, mail order has the lowest overall, but maybe you don't want to get your nitroglycerin through mail order because you only get it once a year. So you might just pay more and get it at one of the other pharmacies. Okay. All right. We then have it mapped out every month, what to expect. Of course, you'll see bump ups every 3rd month because some of these medicines you're getting every 3 months. Okay. So keep in mind with some of them, it's 6 months worth of medication price. Now I'm going to, again, skip the details for each pharmacy at the moment. Show you again, these are your copays or coinsurance. There's no deductible on this plan, so we don't have to worry about that. If there were, you kind of have to point out how do you determine if the deductible applies. But what I want to show you here are the tiers and point out that you need to pay attention if your medicines require or have a yes in any of these columns. Typically, quantity limits, the doctors are well aware of what they will be, okay? But a prior authorization, any medicine that requires prior authorization will require it every calendar year or when you're first entering the plan, okay? So you will need to have your doctor complete something in order for that medicine to be covered. Specifically, I mentioned this is a GLP-1. If you're taking it for weight loss, the plans will not cover it. They do not have to cover it. That's considered cosmetic. But if you're taking it for diabetes, then they will cover that, okay? But your doctor has to give them information so that they know that is why you need that medicine, okay? So looking back then, if we check out these, we saw mail order was your lowest cost. You have your retail cost after deductible because there's no before deductible pricing. Okay. And then if you were to hit that $2,000 cap for your medication costs, then you go to zero. Okay. I want to go back to the $0 plan so that you can see how we can tell what is subject to deductible. This, of course, is going to be a little shocking because this plan doesn't actually cover Lantus. All insulins that are on the formulary cannot be charging you more than $35 a month for your insulin. Now, if you use 5 pens for 1 month, it's $35. But if you use 5 pens and your prescription says that's for 3 months, it will be $105 for 5 pens. Okay. So we'll go back, we'll look at the carriers that cover Lantus, so you'll see the $35. But what I wanted to point out here, let's use this as an example. You can tell if a medicine is subject to deductible if the price point is higher in the before versus the after. Now, keep in mind, most of the plans have the government max allowed deductible this year, which is $590. So you're not going to pay $1,059. You would pay $590 plus a $264 copay for that medicine. But that's how you tell if the medicines are subject to deductible. If somebody is picking up Lantus on this plan, it wouldn't count towards the cap either. But they could, let's say if it's middle of the year, you're on a plan, you get switched to a different insulin, you can have your doctor file a formulary exception as well. Okay. I'm going to go back and show you with the Cigna plan because I believe it covers the Lantus. And so now as we're looking at this one, and we can see here, insulin, $35 there. Mounjaro would be subject to the deductible and then a $221 copay. Okay. But ultimately, what you need to know is this tool, when you get to this first page with all the drug plans showing, and I apologize, there's always kind of a lag, and I'm sharing my screen, it will ultimately map out for you your best drug plan. Okay. Now, one of the questions I have had is if you're on expensive medicines and you're going to be spending $2,000, why wouldn't you just take the $0 drug plan or the lowest premium? And the reason would be right here. The reason is simply your drugs may not be on their formulary and you'll have to jump through hoops or change your medicines, okay? But also, the higher priced plans that have a higher premium and no deductible, they have discounts going on behind the scene. So sometimes you're taking high priced medicine, and even though you're on a higher premium, okay, you might be spending, a lot more on your premium, but very little on your medicine and not even reach the $2,000, okay? Because the $2,000 is only on the medication cost. So let this tool guide you on what you need, on what your best plan is. We do have these instructions written out and saved on a PDF. We are more than happy to email them to you if you would like them. I am going to share our contact information. If you need any assistance on how to get started, we will be doing this webinar again on the first Wednesday in August and in September at 10 a.m. So we are here to make sure you know how to do this. I know in the past we made it easier. We mailed out a letter, you sent us lists, we looked it all up, we helped you make a change. We just can't do that anymore. The carriers are no longer paying us. We are not allowed to charge a fee to do that work either. We have been asked about that, but we are not allowed to charge a fee. If we charge a fee, we become non-compliant and we could lose our license. So we're not wanting to have that happen. We want to remain compliant. That's very important in the insurance world, okay? So our goal is to equip you with all the tools that you need. We will have a PDF. We do have one written right now. We will actually update that right there at the beginning of October again and have it posted on our web page. Because the website itself does change. So that main page where if you're on your search engine, let's say it's Google, and you put in Medicare.gov, that main page could change and update some, and it can get kind of confusing. You know, they could move all of these over to the right-hand side, and now you're searching. Just look for Find Drug and Health Plans. I also encourage you, if you don't have a Medicare.gov account, you can set up a login. You go to My Drugs, you enter all of your medicine. You can even pull in what has been claimed to help you know how you pick that up, okay? So this tool has a lot of usable features that are not proprietary to us. Anyone has access to them, okay? So I think I've covered everything. I do want to make sure you know how to reach us. So if you need any of the PDF with instructions, you need a reminder on what to look for, reach out to us. We're going to be guiding you. Again, we'll be doing the webinar in August and September, the first Wednesday of the month at 10 a.m. Hoping to get this recording out, posted to our website as well. So look forward to talking to all of you. If you need some more guidance, we have a team of people. We're all here to help you. Very well equipped to answer your questions. So thank you for attending today. Have a wonderful holiday coming up. Thanks.